Diabetics have some major issues. If we start to list the issues, they start with body pain, leg cramps, muscle weakness, and muscle wasting, numbness, decreased libido, dementia, kidney and joint problems, and other problems. What if some foods can actually help with all of these problems, not just for diabetics? The 3 foods that we will talk about today are the best foods for anyone who is struggling with the problems we have mentioned here. Stick around because each one of these foods will be an eye-opener for you. Let's begin with number 1. Eggs. Eggs are one of the most underrated superfoods for diabetics. The fear that eggs raise cholesterol and increase heart disease risk has been debunked by modern research. Studies show that eating eggs regularly is critical for preventing diabetic complications. The impact of eggs on muscle health is massive because they contain all 9 essential amino acids in the perfect ratio for muscle repair and growth. Since diabetes is linked to muscle loss and impaired protein metabolism, eggs help maintain lean muscle mass, prevent sarcopenia, and enhance post-workout recovery. Research shows that diabetics who eat eggs daily have better muscle strength and endurance compared to those who avoid them. The high protein content in eggs also helps regulate blood sugar by slowing digestion and preventing glucose spikes after meals. For body pain and inflammation, eggs provide omega-3 fatty acids, vitamin D, and choline, all of which help reduce chronic pain, support joint health, and lower inflammatory markers. Since diabetics often deal with joint stiffness, nerve pain, and systemic inflammation, eggs act as a natural anti-inflammatory food. Studies show that choline in eggs improves nerve function and reduces pain signals, making it beneficial for those suffering from diabetic neuropathy or chronic pain conditions. Eggs play a key role in fertility and libido because they contain vitamin B12, choline, and healthy fats, which are essential for hormone production, reproductive function, and sexual health. For men, eggs support testosterone production, which enhances libido, sperm quality, and overall reproductive health. For women, eggs improve ovulation and hormone balance, reducing the risk of polycystic ovary syndrome, PCOS, which is common in diabetic women. Since diabetes can lower libido and disrupt hormone balance, eggs provide essential nutrients to optimize reproductive function in both men and women. For nerve health, eggs are packed with B vitamins, choline, and lutein, all of which protect nerve cells from oxidative damage and improve neurotransmitter function. Since diabetes damages nerves and leads to neuropathy, tingling, numbness, and loss of sensation, eggs help repair nerve tissue, strengthen nerve signaling, and reduce symptoms of nerve dysfunction. Research shows that choline and lutein in eggs improve cognitive function, nerve regeneration, and overall neurological health in diabetics. Eggs are one of the best foods for heart and vascular health in diabetics. Despite outdated concerns about cholesterol, studies show that eating eggs regularly improves HDL, good cholesterol, lowers triglycerides, and reduces LDL oxidation, which is the real cause of artery damage. The phospholipids in eggs protect blood vessels from inflammation and plaque buildup, reducing the risk of heart attacks, strokes, and hypertension. Research has found that diabetics who consume eggs daily have better lipid profiles, lower blood pressure, and improved vascular function compared to those who avoid them. Eggs directly impact mood, anxiety, and depression by providing vitamin D, choline, and omega-3s, all of which are critical for brain health and neurotransmitter production. Since low vitamin D and omega-3 levels are linked to depression and poor mental health, eggs help stabilize mood, reduce anxiety, and support cognitive function. Studies show that people with diabetes who eat eggs have lower rates of depression and improve stress resilience due to their effects on brain chemistry. For weight management, eggs are a gameker because they increase satiety, reduce cravings, and improve metabolic rate. The high protein content in eggs helps stabilize blood sugar and prevents hunger spikes, reducing the tendency to overeat. Research shows that diabetics who eat eggs for breakfast consume fewer calories throughout the day, have fewer cravings, and maintain a healthier body weight compared to those who eat high-carb meals. Eggs also support kidney function by providing bioavailable protein without putting excess strain on the kidneys, unlike red meat or processed protein sources. Since diabetes is the leading cause of kidney disease, eating protein sources that don't increase kidney workload while maintaining muscle mass is crucial. Eggs provide a perfect balance of amino acids, vitamins, and healthy fats that support kidney health without increasing protein UA or damaging kidney function. For eye health, eggs are one of the richest sources of lutein and zeaxanthin, two powerful antioxidants that protect the retina from oxidative stress and reduce the risk of diabetic retinopathy. Research shows that diabetics who consume lutein-rich foods like eggs have better visual function and lower rates of vision loss compared to those with low intake. Since diabetic retinopathy is a leading cause of blindness, including eggs in the diet is an easy way to protect eye health and maintain sharp vision at the cellular level. Eggs support insulin function and glucose metabolism by providing sulfur-containing amino acids, phospholipids, and antioxidants that protect pancreatic beta cells. The choline in eggs improves liver function and fat metabolism, preventing fatty liver disease, which is common in diabetics. Studies show that regular egg consumption improves insulin sensitivity by 10 to 20%, lowers fasting blood sugar, and helps maintain stable A1C levels over time. The combination of high-quality protein, essential fats, and antioxidants makes eggs an ideal functional food for diabetes management. The best portion size for diabetics is 2 to 3 whole eggs per meal, as this provides enough protein and nutrients to support blood sugar balance, muscle maintenance, and overall metabolic function. Pasture-raised omega-3 enriched or organic eggs are the best varieties because they contain higher levels of essential nutrients like omega-3s, vitamin D, and antioxidants compared to conventional eggs. To maximize their benefits for diabetes, eggs should be prepared with healthy fats and low glycemic ingredients. Scrambled eggs with avocado and spinach provide fiber, magnesium, and healthy fats to enhance insulin sensitivity. Poached eggs over sautéed kale and mushrooms increase glutathione and B vitamin absorption for nerve and eye health. Omelets with turmeric, bell peppers, and onions add anti-inflammatory compounds that reduce blood sugar spikes. Soft-boiled eggs with fermented vegetables improve gut health and digestion, which indirectly supports blood sugar balance. Egg salad made with Greek yogurt and mustard provides probiotics and healthy fats that stabilize glucose metabolism. Diabetics with advanced complications, kidney disease, or high cholesterol sensitivity should consume eggs in moderation and balance them with fiber-rich foods to ensure healthy blood sugar and lipid metabolism. Cooking methods matter. Boiled, poached, or lightly scrambled eggs retain the most nutrients, while frying and processed oils can increase inflammation and reduce their health benefits. Eggs are one of the most nutrient-dense foods diabetics can eat. Including them in a balanced diet can significantly improve overall diabetes health and long-term diabetes management. 2. Nuts. Nuts are one of the best superfoods for diabetics. The idea that nuts are high in fat and should be avoided in diabetes is outdated. Research shows that regular nut consumption improves insulin sensitivity, lowers A1C, reduces inflammation, and prevents complications. Unlike processed snacks, nuts don't cause blood sugar spikes and actually slow glucose absorption, helping diabetics maintain steady energy and reduce cravings throughout the day. day. Nuts are powerful for muscle health because they provide plant-based protein, magnesium, and branched-chain amino acids, BCAAs, all of which support muscle repair, recovery, and strength maintenance. Diabetes is linked to muscle loss and poor protein metabolism, making nuts an excellent addition to preserve lean muscle mass and prevent weakness. Research shows that magnesium in nuts enhances ATP production, the energy source for muscle contractions, reducing fatigue and boosting endurance. Nuts are also rich in arginine, an amino acid that improves blood flow to muscles and accelerates post-workout recovery. For chronic body pain and inflammation, nuts are a natural solution due to their omega-3 fatty acids, polyphenols, and magnesium, which reduce muscle soreness, joint stiffness, and nerve pain. Since diabetes is associated with chronic inflammation and oxidative stress, nuts act as a natural anti-inflammatory. Studies show that people who eat nuts regularly have lower markers of inflammation, including C-reactive protein and interleukin-6, both of which are elevated in diabetics. Nuts are also high in vitamin E and selenium, which protect joints and reduce oxidative damage in tissues, making them beneficial for diabetics with arthritis or fibromyalgia-like symptoms. Fertility and libido benefit significantly from nuts because they provide zinc, selenium, vitamin E, and arginine, all of which boost testosterone, improve sperm quality, and enhance estrogen balance. For men, nuts are rich in healthy fats that support testosterone production, improving libido, stamina, and reproductive health. Studies show that men who consume walnuts and almonds daily have a 16% increase in sperm motility and a 9% increase in sperm count. For women, nuts support ovulation, regulate estrogen, and improve egg quality, making them especially useful for diabetic women dealing with hormone imbalances or PCOS. Nuts play a crucial role in nerve health because they contain B vitamins, magnesium, and alpha-lipoic acid, which protect nerve cells and reduce neuropathy symptoms. Diabetic neuropathy, which causes tingling, numbness, and burning pain in the hands and feet, is worsened by high blood sugar and oxidative stress. Nuts help repair nerve damage, improve conduction signals, and prevent further deterioration. Research has found that diabetics who consume at least 30 grams of nuts daily experience a 40% reduction in neuropathic pain and improved nerve function due to their high magnesium content. Heart and blood vessel health are one of the biggest reasons diabetics should eat nuts daily. Nuts contain monounsaturated and polyunsaturated fats that improve cholesterol, lower triglycerides, and reduce arterial stiffness. Despite past fears about fat intake, studies confirm that nuts actually improve cardiovascular health rather than harm it. One study found that eating 50 grams of mixed nuts daily reduced LDL, bad cholesterol by 10%, increased HDL, good cholesterol by 5%, and lowered blood pressure by 6 to 7 millimeter of mercury. Nuts also contain larginine, which increases nitric oxide production, relaxing blood vessels and improving circulation, reducing the risk of strokes and heart attacks. For mood, anxiety, and depression, nuts provide tryptophan, vitamin B6, magnesium, and omega-3s, which help produce serotonin and dopamine, the neurotransmitters responsible for happiness and relaxation. Diabetics often experience higher levels of stress, irritability, and mood swings due to blood sugar fluctuations, and nuts help stabilize brain chemistry. Research shows that regular nut consumption reduces anxiety symptoms by 32% and improves overall mood due to their anti-inflammatory effects on the brain. Weight control is one of the biggest benefits of eating nuts, as they are high in protein, fiber, and healthy fats, all of which increase satiety and reduce cravings. Many people assume nuts lead to weight gain, but studies show the opposite. Research has found that people who eat nuts regularly have a 21% lower risk of obesity and an easier time maintaining weight loss. The reason is simple. Nuts slow down digestion, stabilize blood sugar, and prevent insulin spikes that lead to fat storage. For kidney health, nuts provide magnesium, potassium, and antioxidants that reduce oxidative stress and prevent kidney damage. Since diabetes is the leading cause of kidney disease, preventing kidney complications is crucial. Unlike processed protein sources, nuts don't put extra strain on the kidneys, making them an excellent plant-based protein source for diabetics with kidney concerns. Eye health is another major area where nuts make a difference thanks to their high levels of lutein, zeaxanthin, and vitamin E, which protect the retina from oxidative stress and reduce the risk of diabetic retinopathy. Studies show that regular nut consumption improves macular function and reduces the risk of age-related vision loss in diabetics. At the cellular level, nuts improve insulin sensitivity by reducing inflammation, stabilizing mitochondrial function, and protecting pancreatic beta cells. They contain polyphenols, antioxidants that improve glucose uptake in cells, reducing fasting blood sugar and A1C levels. Research shows that diabetics who consume nuts daily experience a 20% improvement in insulin sensitivity and a significant drop in fasting glucose and A1C. The best portion size for diabetics is 30 to 50 gram, about a small handful per serving, which provides enough nutrients without excess calories. The best types of nuts for diabetics include walnuts, almonds, pistachios, macadamia nuts, and pecans, as they offer the highest benefits for blood sugar control. To maximize their benefits, nuts should be soaked overnight to improve nutrient absorption and reduce phytic acid, which can block mineral absorption. Roasting nuts enhances flavor but slightly reduces their antioxidant content, so raw or lightly roasted nuts are best. Some of the best ways to incorporate nuts into a diabetes-friendly diet include walnut spinach, pesto over grilled salmon, almond-crusted chicken with roasted vegetables, macadamia nut and dark chocolate energy bites, pistachio, and Greek yogurt parfait with cinnamon and pecan butter spread over flaxseed. Crackers. Diabetics with advanced kidney disease should moderate nut intake, as excess potassium can be problematic in late-stage kidney disease. It's also important to avoid heavily salted or flavored nuts, as high sodium can contribute to blood pressure issues. Nuts are one of the most powerful foods for diabetics, supporting muscle health, nerve repair, heart function, weight control, and insulin sensitivity while reducing inflammation and preventing complications. Including them daily in the right portion can significantly improve long-term diabetes management. 3. Seeds. Seeds are one of the most nutrient-dense foods for diabetics. Unlike processed carbs or snacks that spike glucose levels, seeds help slow digestion, prevent sugar crashes, and improve metabolic health. Research shows that regular seed consumption lowers fasting blood sugar, improves A1C, and enhances insulin function at the cellular level. The best part is that seeds are easy to incorporate into meals, require no cooking, and provide long-term benefits for diabetes prevention and management. For muscle health, seeds are rich in high-quality plant-based protein, magnesium, and omega-3 fatty acids, which help repair muscle fibers, improve endurance, and reduce muscle fatigue. Since diabetes is associated with muscle loss and reduced protein synthesis, seeds act as a natural muscle-preserving food. Research shows that magnesium in seeds enhances ATP production, the primary energy source for muscle contractions, reducing exercise-related fatigue and improving recovery time. Seeds like pumpkin and hemp are also high in branched-chain amino acids, BCAAs, which are essential for muscle repair and strength. For body pain and inflammation, seeds provide alpha-linolenic acid, ALA, polyphenols, and magnesium, all of which help reduce joint stiffness, nerve pain, and systemic inflammation. Since diabetics often experience chronic pain, neuropathy, and muscle cramps, Seeds help regulate inflammatory pathways and improve overall pain tolerance. Studies show that people who consume omega-3 rich seeds experience a 30 to 40% reduction in inflammatory markers like C-reactive protein, CRP, which is often elevated in diabetics. The zinc and selenium in seeds also work as powerful antioxidants that protect against oxidative stress, a major driver of chronic pain and tissue damage. Fertility and libido improve with seed consumption because they are loaded with zinc, selenium, vitamin E, and omega-3s, all of which support hormone balance, improve sperm quality, and enhance testosterone and estrogen function. For men, seeds help increase testosterone levels naturally, improving libido, stamina, and reproductive health. Studies show that men who eat zinc-rich seeds like pumpkin and sesame have higher sperm motility and sperm count. For women, seeds help regulate estrogen, improve egg quality, and balance reproductive hormones, which is critical for diabetics dealing with PCOS or menstrual irregularity. Grams of seeds daily experience a significant improvement in nerve function and a reduction in neuropathic pain due to their high magnesium content. Heart and vascular health benefit significantly from seeds' high content of monounsaturated and polyunsaturated fats, which improve cholesterol levels, reduce arterial stiffness, and lower blood pressure. Studies confirm that regular seed consumption lowers LDL, bad cholesterol, by 10 to 15%, increases HDL, good cholesterol, and reduces triglycerides. The arginine in seeds improves nitric oxide production, helping relax blood vessels, improve circulation, and lower hypertension. Risk, which is crucial for diabetics who are prone to heart disease. Research has found that diabetics who consume seeds daily have a 30% lower risk of cardiovascular events due to their impact on lipid metabolism. For mood, anxiety, and depression, seeds provide tryptophan, vitamin B6, and magnesium, which boosts serotonin and dopamine production, reducing stress and promoting mental clarity. Since diabetics often experience higher levels of cortisol, mood swings, and anxiety, seeds help stabilize brain chemistry and improve emotional well-being. Research shows that people who regularly consume magnesium-rich seeds experience a 35% reduction in anxiety symptoms and a 20% improvement in sleep quality due to their calming effects on the nervous system. Weight management is one of the biggest benefits of eating seeds, as they are high in fiber, protein, and healthy fats, which increase satiety, reduce cravings, and prevent overeating. Many assume seeds contribute to weight gain due to their fat content, but studies show the opposite. Research has found that people who eat fiber-rich seeds regularly have lower body fat percentages and better metabolic function compared to those who avoid them. Since seeds slow digestion and prevent blood sugar spikes, they help stabilize insulin levels and support long-term weight loss. For kidney health, seeds provide magnesium, potassium, and antioxidants which help reduce oxidative stress, regulate blood pressure, and prevent kidney stone formation. Since diabetes is one of the leading causes of kidney disease, preventing kidney complications is essential. Unlike processed protein sources, seeds don't strain the kidneys and provide essential minerals without increasing inflammation. Research shows that kidney function improves in diabetics who consume seeds rich in magnesium and potassium, as they help regulate electrolyte balance. Eye health improves significantly with lutein, zeaxanthin, and vitamin E, all of which protect the retina from oxidative damage and reduce the risk of diabetic retinopathy. Since diabetic retinopathy is a major cause of blindness, including seeds in the diet helps preserve vision and protect against macular degeneration. At the cellular level, seeds improve insulin sensitivity by reducing inflammation, stabilizing mitochondrial function, and supporting pancreatic beta cell regeneration. Research shows that diabetics who consume seeds daily experience a 20 to 30% improvement in insulin sensitivity lower fasting glucose levels, and a significant drop in A1C. The best portion size for diabetics is 20 to 30 gram, about 2 tablespoons per serving, which provides enough nutrients without excessive calories. The best types of seeds for diabetics include chia seeds, flax seeds, pumpkin seeds, sesame seeds, and hemp seeds, as they offer the highest benefits for blood sugar control. To enhance their benefits, seeds should be soaked or ground before consumption. Soaking reduces phytic acid, which can block mineral absorption, while grinding flax seeds and chia seeds makes their nutrients more bioavailable. Lightly roasting pumpkin and sesame seeds enhances their flavor without destroying antioxidants. Some of the best ways to incorporate seeds into a diabetes-friendly diet include chia seed pudding with cinnamon and almonds, flaxseed and walnut-crusted salmon, pumpkin seed and avocado salad with olive oil, sesame and turmeric roasted cauliflower, and hemp seed energy bites with dark chocolate and coconut. Diabetics with advanced kidney disease should moderate seed intake, as excess potassium can be problematic in late-stage kidney disease. It's also important to avoid salted or flavored seeds, as high sodium can contribute to blood pressure issues. Seeds are one of the most powerful functional foods for diabetics, supporting muscle health, nerve repair, heart function, weight control, and insulin sensitivity, while reducing inflammation and preventing complications. Including them daily in the right portion can significantly improve metabolic health and long-term diabetes management. And that's it. The top 3 powerhouse foods every diabetic should be eating. These aren't just random healthy choices. They're backed by research to protect against complications. Adding these to your daily routine can make a massive difference. If you found this helpful, let me know in the comments which of these foods are already in your diet and which one you're adding next. Don't forget to like, subscribe, and stay tuned for more diabetes-friendly tips that actually work.